Welcome to Rumsey Vital Signs. My name is Alex Lutz. On our show, you'll meet the fantastic people who make Richmond University Medical Center thrive. Rumsey is an award-winning full-service hospital located right here on Staten Island at 355 Bard Avenue. To learn more about the full array of services provided at Rumsey, visit www.rumcsi.org. An enlarged prostate, or benign prostatic hyperplasia, is a common condition that affects men as they age. According to the National Institutes of Health, BPH affects about 50% of men between the ages of 51 and 60 and up to 90% of men older than 80. BPH is not a cancer, and it's not usually a serious threat to a person's health, but it may lead to other conditions and affect quality of life. There is a solution currently available at Richmond University Medical Center's Urological Services Center called UroLift. Here to discuss this non-surgical procedure is board-certified urologist Dr. Richard Maggio. Thanks for joining me.
Thank you for having me.
So let me start by asking, what causes BPH and what are the symptoms?
So as you said, as men get older, the chance of BPH increases. So age is one factor. Another factor is the hormonal environment. As men get older, there are hormonal changes which cause enlargement of the prostate. Other thing is genetics and some lifestyle issues.
And what are some of the symptoms of BPH?
So BPH is typically characterized by increased frequency of urination, urgency to urinate, slow urinary stream, feeling of incomplete emptying or post-void fullness, waking up at night to urinate. Those are the most common symptoms.
So how do you diagnose BPH?
So if a gentleman comes into the office complaining of the symptoms that we just discussed, obviously you take a history and physical with a rectal examination, which is necessary. We do some, we'll get a PSA, which is a blood test for prostate-specific antigen. We do some imaging studies for the prostate to get the volume. We do a cystoscopic examination to look at the prostate shape and size, as well as look at the condition of the bladder. And we usually do a uroflow test to see how badly the patient's flow is obstructed.
And so tell us, what is UroLift?
So UroLift is a minimally invasive procedure where we implant devices into the prostate, these little implants that basically lift and separate the prostate lobes to open up the channel so that you can urinate better.
Okay, so what are the advantages of the UroLift procedure?
So the advantages are that it's minimally invasive. It's a short operative procedure, usually less than 30 minutes or so. Minimal downtime. There is the prostate tissue is left intact. It's just opened up. There's no destruction of prostate tissue, heating of prostate tissue, or removal of prostate tissue. So it still stays there. And the biggest benefit to this procedure is that it preserves sexual function. Typically, with many of these procedures, there can be either retrograde ejaculation, medications cause retrograde ejaculation, or blood pressure problems, but those don't occur with the UroLift procedure. And
who qualifies for UroLift?
So anybody that has an enlarged prostate. However, there are certain specifications. People who have a prostate under a certain size, as well as a certain shape of the prostate. The prostate, there shouldn't be a big intravesical lobe in the prostate that would cause us not to be able to do UroLift. So it's basically open for any man can have a UroLift. They just have to be a good candidate for it.
Gotcha. So we have a demonstration video of the UroLift procedure. So why don't you walk us through the actual procedure?
So this is the scope which deploys the device. It's going into the prostate. And
now the patient is sedated, right?
Patient is sedated, yes. So it's basically showing us what the operator does on the right bubble. And then we look at the location where we put our devices, and it deploys a needle, which goes through the prostate capsule. And then we compress with the device. It deploys an anchor, which is demonstrated by the circular area. And then there's a urethral end piece. That'll be shown in a second.
And is this all metal? Is this?
So there's titanium.
Okay.
This piece that's in the urethra is titanium.
Okay.
And that's a non-absorbable suture.
Okay.
So as you see, it compresses the prostate tissue and opens up the channel. I often tell patients that if you think of the prostate like a donut, and the hole is where the urine goes through, as the prostate gets bigger, the hole gets smaller. So we need to do things to open up that channel so that the bladder could empty more efficiently. Again, typically we put anywhere between 4 to 7 implants in the prostate.
Okay.
So this just shows how it's deploying the end piece to pull open the prostate tissue.
And the number of these, you don't know till you're actually in there how many you need?
Yes. I mean, typically, as the procedure goes, you see how well the prostatic urethra is open, and then you kind of assess as you go along. But you see, after the prostate is wide open.
That's amazing. And this is, you said, about a 30-minute procedure?
It's about a 30-minute procedure. And the interesting thing is that when patients get over the irritation just from the procedure, which is about 7 to 10 days, the results are immediate. So patients note a big improvement in the way they urinate. In fact, we get an IPSS score after their procedure, a few weeks to a month after their procedure, and we see that there's at least a 60% improvement in their IPSS score. So patients do really well. It's a life-changing procedure for most patients.
And the implanted devices, they stay in permanently?
Those are permanent.
Those are permanent?
Those are permanent.
And after someone has the initial procedure, do they come back for a follow-up, a checkup, or anything like that?
So usually I have patients come back several weeks after the procedure, and then a few months down the road. And then if they do well and they're continuing to do well, maybe every 6 months to a year.
Wow. And how many of these procedures have you done since you started doing UroLift?
So since we started doing UroLift, we've done over 150 procedures. We're actually, our second year is designated as a Urology Center of Excellence, or a UroLift Center of Excellence.
And what do you have to do to accomplish that designation?
It has to do with education, it has to do with the number of cases, and the improvement that you get in your IPSS scores for patients.
And how long has UroLift been available for people?
UroLift has been available probably for at least 10 years or so. I used to do them a while back, but unless you are proficient in it or do many of them, then it's very hard to kind of get good results. But
are there any side effects to UroLift?
Really, no side effects. I mean, sometimes a piece can break off during the procedure. If the implant is not seated adequately, you'd have to take that out. But otherwise, post-operatively, really minimal risks to the procedure. There's always a risk of infection or bleeding after the procedure, but short of that, not much. And
in the time that you've been doing helping people here on Staten Island, have you noticed any kind of trends here on Staten Island regarding BPH? Is it a little higher than average for Staten Island, or trends like that? I mean, I think it's probably runs on par with what the national average is. I don't see any increase in BPH just on Staten Island. And other than UroLift, I know we're going to talk later on about aquablation. What are some of the other conditions that you're treating pretty commonly on Staten Island? So we treat a lot of stones. We treat a lot of cancers, prostate cancer, bladder cancer. And stones probably are the biggest things that we treat. And are the cancer rates high here on Staten Island? I think, we see a lot of prostate cancer, a lot because of 9/11 also. Oh, really? It's been one of the cancers associated with 9/11. So we see patients with, a fair number of patients with prostate cancer. And these are people obviously that were exposed on 9/11 in Lower Manhattan? Yes. Wow. Still seeing the after effects of that terrible day. So when someone comes to you for UroLift, is there a hesitancy? How do you explain UroLift to somebody? So I basically just, if it's a new patient that has, bothersome urinary symptoms and affects their quality of life, I ask them how they want to be treated, or I give them the options of what can be treated. We have medication treatment, we have minimally invasive procedures, or we can just watch and wait depending on how badly the symptoms bother them. The biggest reason to push to get treatment for BPH is really bladder health. Our understanding has changed in that as the bladder works harder and harder against the obstruction, it begins to decompensate, so that the bladder may not empty efficiently. You may hold a lot of urine into the bladder when you think the bladder is empty,
that can lead to complications of infections. It can lead to kidney obstruction, so that there are other things, if left untreated, BPH can cause.
I see, I see. Well, what would you say to someone that sees this episode and it says, "Wow, I think this might be something I want to do," but they're a little hesitant? What would you say to them?
Well, I would, let them know that, there's help for any condition that you have as far as urinary condition associated with BPH. And there are a lot of options to choose from. This is not the only one, but it's a good viable option. Patients do really well, and just consult with your urologist to see what would be best for you.
Great. Well, thanks for taking the time to introduce us to the UroLift system.
You're welcome. And
Rumsey's Urological Services Center, as you had said, has got the prestigious title of a UroLift Center of Excellence. So I want to thank Dr. Maggio for his expertise and the procedure and commitment to quality and patient safety.
Thank you.
When we come back, we'll discuss another urological procedure for BPH known as aquablation.
See it coming. It's prediabetes, and it captures 1 in 3 adults. But you can escape. Take the 1-minute prediabetes risk test to know where you stand and prevent or delay type 2 diabetes. Be your own hero on smartphones everywhere at doihaveprediabetes.org.
I'm an actor in an ad that was given 12 seconds to remind you that if you're high, just don't drive. Because if you feel different, you drive different. It's illegal to drive high everywhere anyway.
Hey, boss. Okay?
Yeah, I'm good.
You sure?
I said I'm fine.
Since I was little, it was only like me and my parents.
You think you created family out of characters?
Yeah, of course.
I'm gonna take that, make it into a song.
Put me to bed, see you in the morning. With the frosted Superman, but it wasn't on it. And we lost it. In my head, in my head, in my head. Where you at, where you at on the way out? In my head, in my head, in my head.
Hey, son.
Hey, Pop.
You can talk to me.
It's been really, really hard for me.
We're back. Thanks for joining me for this episode of Rumsey Vital Signs. We're now joined by Dr. Michael Wilson, board-certified urologist and surgeon who also specializes in treatment for a wide array of urological conditions, including BPH. Thanks for joining me, Dr. Wilson.
Thanks for having me.
Earlier, Dr. Maggio talked about BPH and introduced us to the UroLift procedure. But there's another revolutionary procedure for BPH that simply uses the power of water. Can you tell us more?
Sure. The procedure you're referring to is aquablation. It uses a water pressurized jet to actually carve out a channel for you to pee through. And it can take care of prostates from very small size to quite large prostates.
And what are the advantages of aquablation?
So the advantage of aquablation, kind of, if we take a step back, is that most men, when they have enlarged prostates, you're talking prostates that are above 100 grams in size. You know, for comparison, a normal size prostate's about 40 grams. So these big prostates, you know, the options for treating them tend to be more invasive because you need to remove more tissue. So the benefit is, you know, a big prostate, they've done things as open, simple prostatectomies where you make an incision in the belly and take out the prostate. We do the same thing robotically. What aquablation, it allows us to do this procedure with no cutting. So essentially, the procedure is all done through the penis. Very much like procedures Dr. Maggio spoke about, the UroLift. It's all done through the penis. So essentially, it's a robotic system that's ultrasound guided that allows us to map out the actual length and the anatomy of the prostate. And then the water pressure jet kind of carves them out. And the real benefit of it is immediately you get that channel to pee through. But a few weeks later, as that tissue starts to slough off and die, the channel actually gets bigger. They've done several videos that show, you know, if you look at it initially and then at 2 weeks, a month later, the channel gets much bigger as everything heals afterwards.
And who actually qualifies for aquablation?
So that is an ever-changing answer in regards to that. Currently, it's patients under 80, but as of April, that will be going away, and there will be no age restriction on that. Even patients now with prostate cancer, you know, historically, if they had prostate cancer and BPH, you know, this was not an option for them. Starting this year, that was approved. So it really encompasses a large percentage of the population. There is no age restriction starting in April. Medicare usually does cover this along with other private insurances. And pretty much as long as you've tried medical therapy, whether you failed it or not, it's pretty much a good option on the table.
Is it common to have an age restriction on a procedure?
Newer procedures tend to do that because there's always red tape. Aquablation's been around for about 10 years or so, but with the mainstream aspect has gained more popularity in the past 5 years. And actually, recently I was at a meeting and the talk is that it will replace a TURP or Roto-Rooter, as some men will hear it, as the gold standard eventually in regards to it, because one of the real big benefits, and I know Dr. Maggio alluded to this with the UroLift, is preservation of sexual function. You know, when you get a TURP, you're likely going to end up with retrograde ejaculation. That is a very well and common side effect of that. Aquablation does not cause that. In 9 out of 10 patients, that's preserved. So to have somebody with a prostate that's, you know, 70, 80, 90, over 100 grams, and you're able to preserve their ejaculatory function, you know, that's pretty amazing that we've had this technology at this point.
And as a surgeon, when you hear about this procedure that comes along like aquablation, before you decide to say this is something I want to pursue further, walk us through that part. Like, is this something I want to start to learn about? What's the training like before you actually do it?
So I had the benefit of doing some of this while I was in residency when it was really kind of fairly new, but you know, you learn about it, you get to watch the videos of it, you see some of the cases being done, and then you start doing the cases. I have colleagues all over the country that do this now, and you know, the rapid growth of aqua kind of speaks to its, you know, benefits that patients are searching this out, I would say. You know, and as you go through the process and you do more and more cases in regards to this, you know, you get, as you do with anything, you get better and better and more efficient with these cases. In general, patients do really well with these type of procedures, and you know, you're saving somebody from incisions on their belly or incisions in their abdomen. For a case, you know, some of these cases take as little as 30 minutes. Most cases take about an hour or so, and some even a little bit longer, just depending on the anatomy and what goes on.
So when you have someone who's going to have the procedure done, obviously it's under anesthesia?
Yes.
Okay. And how long does the procedure take?
It really fluctuates depending on the person's anatomy and prostate size, but average is about 45 minutes to an hour.
Okay. So we have a video demonstration of aquablation.
Sure.
That we can call up here. And if you want to just kind of walk us through the process.
Sure. So the green lines that you see, if you look at the smaller picture, are an ultrasound probe that's put in the rectum. That's the black line at the bottom. Okay. And that gives us an ultrasound view of the prostate. What you don't see on here is this green line is we've marked out on that ultrasound the areas that we are concerned about and areas that we want to protect. And then once we map that out, the machine and the robot will calibrate, and it gives us a set time for how long a pass will take. And the water pressure jet is a 270-degree circumference that it covers in a butterfly pattern. And really the prime way that it helps with the retrograde ejaculation, as it gets towards where the ejaculatory ducts enter into the prostate, it does butterfly cuts. So it doesn't do that 270, it preserves the portion where that comes in. And it's actually, the way this works and how it's preserved things has changed the way urology has even thought about a common medication, Flomax, on how it works. you know, the thought process for that was for a long time, it all worked on the bladder neck. And that's why men got retrograde ejaculation. But this is kind of changing the thought process. You know, you go to conferences and you have men having these discussions, men and women having these discussions for something that's been accepted for so long. Yeah. And then once that water pressure jet goes through there, most of the time there'll be another pass that goes along with it. And you take out that tissue, you stop any bleeding that might be, and then they usually have a catheter for a short period of time.
And what's the recovery time like?
So pretty much the recovery time is the catheter comes out in about 2-3 days, sometimes a little bit longer, and then just no heavy lifting or strenuous activities for about 2 weeks. And then most men are kind of back up to their normal daily life after that aspect of it. So pretty much if no strenuous activity and heavy lifting, they're not going to really notice much else.
So are this is done in the hospital?
Yes, it is.
Okay, so they're admitted to the hospital for 2 days or so?
No, so most of these patients are in the hospital overnight. They go home the next day. There are some institutions doing this as same day.
Oh, wow, okay. And are there side effects to it?
So the most common side effects with most surgery, infection and bleeding. Risk for incontinence or leakage of urine is very, very low because you're able to preserve that ejaculatory zone. So it leaves a little bit of prostate tissue there. Retreatment rates for something like this, for bigger sized glands, is less than 4% in 5 years, which is pretty good.
And we had asked Dr. Maggio earlier with UroLift. So after the actual procedure, is there follow-up visits that?
Yes, there is. Initially, when the catheter gets removed, you're seen in the office. Some physicians do allow patients to self-remove their catheter. I'm not a big fan of that.
Yes.
But usually we have them follow up a few weeks later, de-escalate their medication, and then keep an eye on them for a few months. And most men, at that point, if they're peeing fine, you know, just their normal routine follow-ups with their PSAs as needed, and if there's any new issues that transpire.
And how many of these procedures have you done since you've come to Rumsey?
Well, Rumsey, I was able to get it started here at Rumsey, and we've been doing them here at Rumsey since November, and we're over 20 cases at this point, you know, with more cases already scheduled in regards to it. So it is gaining in popularity, and like I said, it's becoming the gold standard.
So we talked about UroLift, and now we've talked about Aquablation. How do you stay up on all the latest procedures and technology that's coming into your field?
Continuing medical education is the simple answer. You know, there are conferences that come out all the time. There are papers, there are, you know, the American Urology Association, the American College of Surgeons. There's constant information going, and every year we're doing new therapies. And, you know, you see the advantages of these things. There's always some think tank somewhere else that, you know, someone's thinking, how can I do this better? How do I improve patient care? You know, and the one thing that we've come to find with BPH is there's many different options, and it's really patient-centered and patient-specific. You know, your goals may be a little bit different than mine. You may just want to pee. I may want to make sure everything's like I never had anything done. So it all just depends on size and shape, and, you know, I think people are addressing that and bladder health more prominently now.
And if someone's watching this episode who just saw the demonstration on Aquablation and is considering it, but might be hesitant by what they saw, what would you say to them?
Well, what I would say is at least come in and have the conversation. You know, if you're not a candidate for Aquablation, there are a ton of other options that we provide at Rumsey in regards to that. And just having the conversation and understanding what your options are and seeing where you fall in that whole spectrum is the best place to start.
And the Urology Services Center offers a wide variety of different options, not just for BPH. So tell us a little bit about the services at the center.
So at the center, we deal with everything from prostate cancer, kidney cancer, bladder cancer, kidney stones, erections. We also deal with female issues as well, overactive bladder. You know, we're all encompassing in regards to it. We have robotic surgery. I myself do robotic surgery. So we do kidney cancer, prostate cancer. We do screenings that you may see us pop up on Staten Island here and there for them. So really, it's all encompassing. We're able to take care of pretty much what Staten Island needs.
And it's located over at 1200 South Avenue, which is actually not too far from the studios here. And obviously, this is an expanding field, urology.
It is ever expanding, and you know, the one thing is everybody's living longer now and getting older, which means we're all having more and more problems with urination.
Well, thanks for taking the time today to introduce us to aquablation and another minimally invasive treatment for a common problem.
Not a problem. Happy to have me.
If you'd like to contact the Urology Services Center to find out more about aquablation, UroLift, or additional services that are available, you can call 718-370-1400. The center is located, as we said, at 1200 South Avenue, right here on Staten Island. My thanks again to Dr. Wilson and to Dr. Maggio for joining us today. Richmond University Medical Center has cared for Staten Island and the New York City metropolitan area for nearly 120 years. You can help ensure that care continues by making a financial contribution to the hospital. Donations can be made in your name, the name of a loved one, or to honor a special nurse or doctor at Richmond University Medical Center. To donate, visit our website at rumcsi.org and click on the Donate button located at the top of the homepage, or you can call 718-818-2106. That just about does it for this episode of Rumsey Vital Signs. Thanks for joining us. I'm Alex Lutz.